Good evening, good afternoon, and good morning to all the viewers that are looking at this live stream all around the world. Very welcome to this live stream experience at Healthskouts. It's our New Year's event. So we're very happy to show some of the inspiring insights and some of the inspiring projects we engaged in last year, but we also want to share some of the ambitions that we have for the future and coming years. But before diving really into the content, there's something very important that I need to tell you. You will see a lot of inspiring things, a lot of inspiring projects, videos, and so on. And it's really important to stress that these are the results of the effort of a great team. So it's really important for me to say a big thank you to Noemi, Stephanie, Janneke, and Rob, and also to our former colleague Dimitri. And a special shout out to Noemi, who could not be here physically because she is, out with COVID. What did you expect? But you're here with us in our minds and in our hearts. So we opened our doors 4 years ago, and actually we evolved from what we call a local experience center into a global experience platform. And that's what we want to show you today. And what is important for you to know is that the passion of Healthskouts is to inform and connect people on the future of health and healthcare. And in order to do so, we created for ourselves 4 goals, 4 pillars, you might call them. And these are 4 words you will hear lots of times. You will hear them often during this live stream experience. So the goals are to inspire, to connect, to create, and to accelerate. And I already mentioned we want to inform and connect people. So everywhere we go, we want to connect with our audience. And also this evening, we want to connect with you. So what you will see during this live stream event is from time to time, a polling question will pop up. And one be a bit more serious than the other. And I really urge you or advise you to answer these questions, because you might be the lucky one that, based on these on your answers, gets selected to come to Healthskouts together with your family or your friends or your colleagues, and to get extra pampered here within Healthskouts. So stay tuned and stay focused. And now let's dive into the content of this evening. And let's start off first with all the amazing people that actually constitute the Healthskouts network. Because let's be honest, without the network, Healthskouts would not be existing. And who is this network? Who is the audience that is coming to Healthskouts? Well, first off, on the one hand, we have all types of medical professionals. Think about nurses, think about surgeons, physicians, also people working at pharmaceutical companies, people working at medtech companies, policymakers, but also military world, and even athletes, sports people are coming to Healthskouts. So medical professionals on one hand, but on the other hand also the layman public. And you will notice that in the future more and more you will see us reaching out to and engaging with layman public. So the network is very important. Next to that, also we have to thank our founding and structural partners, because without them also Healthskouts would not be existing. And the organizations that go along already quite some time with Healthskouts are the following. So the University of Leuven, the University Hospital of Leuven, the City of Leuven, Province of Flemish Brabant, IMEC, COI, and Deloitte. These are the organizations that are already for quite some time with us. But of course, you can imagine that we're always very happy and very proud if we can introduce a new structural partner to our network. And we were very proud and honored that last year we could welcome Bank van Breda as one of our newest structural partners. And maybe you know that Bank van Breda has a portfolio of a lot of medical professionals as their clients. So Bank van Breda uses Healthskouts to inform their clients, the medical professionals, and to keep them updated with the newest technologies in health and healthcare. And we have engaged with them in numerous events, but I really want to highlight a specific event in which we performed together with Bank van Breda a live stream of a panel discussion, and actually a live stream of 3 sets of panel discussions, where experts in the field engaged with the audience, engaged with the clients of Bank van Breda, and talked about relevant topics such as hospitality in healthcare, but also innovation in healthcare and new digital technologies in healthcare. So all relevant topics for the clients of Bank van Breda. Next to having these new structural partners, we're always very happy to see recurring events at Healthhouse, because that means that Healthhouse is really appreciated by people and that Healthhouse is really engaging with people also to tell their story. And next to the happiness we have with recurring events, we are also very excited by the fact that we have a nice set of ambassadors that really are engaging with Healthhouse. And I'm so honored to have one of these ambassadors who was there from the beginning with Healthhouse here with me on the stage. So I really welcome you, Professor Koen Kas.
Yeah, the pleasure is mine.
So very welcome here at Healthhouse. Yeah. And I'm really sure that lots of people in the audience already know you, but still I would like to ask you whether it's possible to give a short introduction on yourself.
Right. So people call me a healthcare futurist, which I cannot do, predict the future, but I think we can create a future. And basically what I try to do is show how the most extreme value-based healthcare of the future could look like. Now you might recall Franklin's quote, who said, well, if I tell you something, I forget. If you teach me something, I might remember. But if you involve me, I will never forget and I will learn. And so when I started to explain on stage how I believe digital technology might allow to enter into the real world of our patients and slowly will be able to turn sick care into real healthcare, then people said, well, sure, but where is all this technology? How does it look like? And that's where basically Healthhouse started to fill a huge gap, because we have had the honor the last few years to bring teams really physically into this space, which came in maybe sometimes not even able to expect what to see, and going out and saying, well, this is the coolest experience we've ever encountered, never ever seen somewhere on the planet. And so we feel endorsed that parts of the things we've learned here, we will try to apply in our company, in our hospital, in our pharma company. And that's the nicest thing you can do, I think. Yes? Spreading the world, bringing people here and showing that they will be part of that future themselves as well.
So for you, I might say that Healthhouse is a place where you inspire your clients, or maybe people that maybe need to be convinced a bit about the innovation that is out there, the challenges, or people that say like, okay, this is not for me. Yeah. So you try to convince them.
Yeah, and it's not like you have to convince them, but by showing how healthcare can be delightful. And delightful means how healthcare can be a super experience. It helps for them to see, well, we can do that ourselves. And let me give you two examples. One of the companies we've invited here was the big dairy company, Danone, which you know from the Actimel. Yes. Now, Actimel contains a number of microorganisms, bacteria, and basically they're for good health. And then comes Corona. And Danone starts to get a very hard time to explain that bacteria could be potentially beneficial for people. And so they came to us, to Healthhouse, to ask, well, can you tell a few stories? Can you come up with a number of stories which we might be able to use to our management and to our consumers to explain that microorganisms do good things? So what we've been doing with the team here, we've shown them how to use VR and AR to swim to my intestines, see these bacteria in action, and that was so inspiring for them that they now are launching a new brand. Will happen in 2 months. It will be called Flux. And Flux is a completely digital brand in which Danone will explain which of the 1,800 bacteria they are currently studying in the future might try to keep me healthy. That started here. I mean, that's fascinating.
That's really great. Yeah. Great to hear that. Yeah. Cannot wait for the brand to come out.
And then that second story, I still recall the Surgeon Generals from the NATO coming here. So we had kind of 30 guys with 75 kind of decorations, all strong guys. And we told them that they would get the tour and that we would start with an experiment on 2 of them after half an hour. So we gave them a sensor, and the sensor came from a fantastic local startup, Biorix, which made an app to measure stress linked with using a wearable. And the fascinating thing is that these strong guys basically when they came closer to the half an hour where the experiment would start, you started to see how with simple app you could start to measure stress and how you could start to play and induce or deal with that stress. For them, that was an eye-opener because they said, well, we came here to learn how the future of healthcare is resembling the future of warfare. In healthcare, we're always behind the facts. We will try to move in the future to prevention. And in warfare, they start to think about the same. Instead of getting into war, can we prevent things from striking, right? And so one of the things they came here to learn was which technology could be used in the army to start predicting things from happening. For instance, I'm with a 40-kilogram package in the desert. I don't think about drinking in time. We showed them a sensor which measures dehydration, which all of a sudden explains them how they can start to take care for their kind of soldiers. So the equivalent between these two worlds, I found that a fascinating way to show how you can inspire not just people in real healthcare, but also people beyond healthcare.
Yeah, that's true, because we noticed that if we look at the organizations coming over to Health House, they're not only the typical healthcare organizations coming over, because in the end, innovation and technology is being used everywhere in each kind of sector. And I have the honor or the privilege to do guided tours for some groups. And exactly what you describe, seeing people being inspired and seeing an eye-opening, an aha-erlebnis, even sometimes, it's really very nice to see, because then you see or you feel that you are creating a kind of an impact.
Absolutely.
Because you might have, shown somebody something that they didn't know, and they might even use it in their current life or in their, future to come life.
Yeah. What is a fantastic story as well is the TV you have. You have a TV with a number of apps, digital health tools. And so each time we show that to people, we say, well, imagine you have such a counter, such a TV screen with apps in your local pharmacy store. So you go to the pharmacy to get some pills, toothpaste, but you see a screen, and on the screen you see apps, which might allow me to deal with my health, explained by a trusted party, the pharmacist. That is something we're currently building with one of the biggest supply chain companies on the planet, McKesson, who came here, who saw this. It took a while before they got converted, but that's currently being built. Again, it started super small here, and a San Francisco company is willing and able to run that and to kind of roll that out into something like 11,000 pharmacy chains. I find that fantastic.
Yeah, that's fantastic and inspiring, and very nice to hear that maybe the little seed was planted here in Health House, and then to hear all these fantastic stories and products and brands coming out of them.
Now it's getting better, because people start to hear the word, what is feasible. And sometimes we encounter kind of an unbelief. How can a t-shirt, washable, measure all the things a normal doctor does do in his cabinets? So one of the discussions we're currently having now is with two companies which the last 6 months got one of these t-shirts certified, trying to get them here so that we can start to show that. If we would have, called them maybe 4 years ago, they might have said, what is Health House? Now when we reach out, they said, wow, is that feasible that we present ourselves in Health House? In 4 year times, that's what you built, which is, I think, a big kind of shout out to the team, that by putting a stake in the ground, building something which didn't exist on the planet, and it's basically filling a need, allows people to say, can we come, show what we have, so that the community around Health House can start to learn and bring things into practice. If I think about the device which shows the Accuvane, my veins, I think we have 8 clinics now using it because they have seen it here.
True.
It's patient delight. I cannot miss. So the next thing we're going to try to do is bring the patch, which doesn't require a syringe to take blood, but basically which sucks blood out of my skin to get that here. I think that will be the next big thing we will be able to introduce into the Belgian hospital system.
You see the smile on my face?
Yeah.
I'm getting really excited hearing that. Yeah. So I really want to thank you to be such a great ambassador for Health House and to bring your network here and to spread the word out. So that's really great.
No, the pleasure is mine. Maybe one last thing. Yes. You know what would be cool? If we start to think on how we could get a visit to Health House or a 2-day visit to Health House into the curriculum of every Belgian university. I think we should really aim for that, not just for clinicians, but for pharmacists, for biomedical people. Because if they get their end degree, they haven't heard about all the things which we do here. And I think that's part of our mission as well, making sure that the educational system gets up to speed to how the future could look like.
There you touch upon a very correct point, and something that we also emphasize, that we see that medical students are getting a great education, but on innovative technologies, we're not there yet. So we have some work to do.
Fantastic.
Right, great. Thanks a lot. Great. So I already told you about our new structural partner, Bank van Breda. But I'm also very delighted to announce the fact that we have another new structural partner. And actually, that's a partnership with Evermove. And Evermove is a Leuven-based company with really global ambitions. And they're all about personal growth. And they created a personal growth experience here at Health House. But I think we better listen to Bert Eckaert, who is the CEO and founder of Evermove, and he can explain the mission of his company and the collaboration with Health House best. Let's take a look.
Hi, my name is Bert Eckaert. I am the founder of Evermove. Our company has as its core mission to inspire and empower people to work on their personal development. We use both science, technology and creativity as the cornerstones of all our activities. And a few years ago we were kind of looking all over the world for a partner that could create next level seminars with us. And so we were looking pretty much all over the place, and lo and behold we found the perfect partner only a few kilometers from our doorstep, and that partner was Health House. And so in the last few years we've been working together with the Health House team to create these immersive personal growth experience where we use both new technologies, science and creativity, and we put that together and we create something very inspiring and immersive. And our experience has been great for the last few years, and I really look forward to continuing our journey together in the years to come.
So as I mentioned in the beginning, I'm also going to tell you something more about our future ambitions. And I'm very happy to announce that Health House is starting a partnership with To Walk Again. And To Walk Again is a not-for-profit organization that tries to support paralyzed people by supporting them with post-rehabilitation. So To Walk Again has a rehabilitation center in Herentals where paralyzed persons can go and can have a session with an exoskeleton. It's really great. I really advise you to take a look at their website to see all the amazing things that they're doing and that they're creating for people that are paralyzed. And together with them, we are going to organize a hackathon with which we're going to search for ways to optimize the exoskeleton that they're currently using, optimizing for giving better comfort for the patient, but also optimizing for giving better comfort for the physiotherapist who is working with the patient and in the exoskeleton. So as said, we value our network a lot. And together with Professor Kas, we mentioned already the inspiring setting Health House is. And to keep people inspired, we always try to create new stories. And when I use the word stories, sometimes I see people thinking a bit strangely, like a story? That's strange. We're not talking about fairy tales, rest assured. We're talking about expert validated and correct content that we bring to our audience in a story-like manner. And we use a lot of digital content for that. So we use movies, also 3D movies, for instance, virtual reality applications, we have a digital dissection table and so on. And we use all these type of digital content to create a movie or a storyline better. And our newest storyline is called Planet Virus. And I think you can imagine which virus we're talking about. Yes, we're talking about SARS-CoV-2, of course, but not only SARS-CoV-2, but more about that later on. You can imagine that in the full corona period, so the first and second and third lockdown and wave that we encountered, that this was a story that was always constantly evolving. So creating a storyline out of such a always evolving content is really, really challenging, to say the least. So we were very happy to have a partner, which is Norval Jefferson. It's a great an amazing creative content agency that helped us to create the Planet Virus storyline with incredible movies. And they really succeeded in bringing a complex story within about 15 minutes time in a very visually attractive manner to our audience. But maybe instead of listening to words, let's take a look at images, because images are so much clearer than words. So let's take a look at a trailer of the Planet Virus storyline.
The year 2020, where a virus outbreak turned into a global pandemic. 2.3 billion people in lockdown, over 1 million people deceased. A new reality that we couldn't imagine or even see coming. Or could we? Our world, in the grasp of the COVID-19 pandemic, where uncertainty, stress, anxiety and negativity created a polarized point of view, driven by self-interest. A worrying trend which isn't helping us to find a positive way in these pandemic times. That's why we wanted to create a new sound. Welcome to Planet Virus, a new educational learning experience created by Healthskouts and Norval Jefferson. Because the only way out is to embrace the facts and become better educated. A place where we can learn from mistakes and celebrate solutions. Where we can develop a broader perspective in which we can trust in the power of collaboration. To contribute to a positive mindset that looks more optimistically to the future.
That right there is the ventilator.
To get through this pandemic and the next. Because together, we'll always find the way out. Visit Planet Virus, the facts-based COVID-19 educational learning experience. Discover it now at Healthskouts.
So to create this ever-evolving storyline, you can imagine that we needed to talk with, well, a lot of experts. I think I'm not exaggerating if I say that we talked with about 100 experts to get really this correct and expert-validated content. And I'm so happy that this evening we have one of these experts sitting here on stage in Healthskouts. And well, very welcome, Professor Johan Nijts.
Good evening.
Good evening. As with Professor Koen Kas, I'm sure that nearly everybody of the audience knows you, but I would like to ask you to introduce yourself.
Okay, I'm a professor of virology here in Leuven at KU Leuven at the Rega Institute. And well, besides teaching, my duties are also, tasks are also to basically run a lab, a research lab. And what we do in the lab is developing antiviral therapeutics, so drugs to treat viral infections, and also vaccines. And that keeps us quite busy.
I can imagine that you're very busy these days. So I mentioned that we talked with a lot of experts, you being one of them. What did you think when we asked to create such a storyline? Was it like, oh, what a crazy idea, because it's an ever-evolving story, and we actually wanted to take a look at the future, like not only talk about viruses, but also what is a pandemic and how to better prepare for the next pandemic.
I thought it was a truly fantastic idea. I just could not imagine what it would look in the end. I mean, and it's just an amazing series of videos. It's the footage is so nice. It's so attractive. It really brings also the information in a very correct way, and people can of course easily access that via the internet. It's really a source of information brought in a way that is digestible and attractive. So it's really nice and really important.
Yes, and there also, of course, Norval Jefferson comes into play, who has really mastered the ability to create a visually attractive story and to show really complex content, but in a manner that people can really relate to it. So yeah, that's a big plus there. What do you think about the relationship between the storyline and policymakers? Is it something policymakers should take a look at?
All of them. The point is that, well, we as virologists, as scientists, have been preaching for years there might be a next pandemic coming. When I'm teaching to my students since years. The students are 20, 21 years old, medical students of dentistry. I'm saying by the time you will retire, you will definitely have seen at least one pandemic. But just as boring scientists, we can keep preaching to, well, let's say at conferences and at meetings and preaching to our students. But in the end, you don't reach the larger audience, except once you are in the middle of a pandemic. But for this, I mean, it's so important that you create this content so that you have basically reach out to a larger audience, not only here in Flanders, not only in Belgium, but also internationally. I think with Planet Virus, you really have something in hand that is really high class, top class level information that can be used around the globe.
And that's true because when we create a storyline, we always envision the storyline to go global. Yeah. Because that's, as I said, we started locally, but now we actually, our ambitions are to go global. And that's why we create such storylines always with that perspective in the back of our heads. That's true. So I'm glad...
And just to come back to the politicians, I think they should all see it, not only just here in Belgium, just internationally. Because just imagine that leadership of the world had taken the message of the scientists, of the virologists a bit more serious. Perhaps we would not faced this pandemic as we have seen it happening in the last 2 years. The world would have been better prepared, perhaps, as all these countries are sort of preparing against an enemy by buying military equipment, and trillions of dollars and euros are being invested in military equipment. There was basically almost no investment in preparing for a pandemic that we knew would come one day. And I think, again, the information that you bring in this movie is hopefully for the current politicians around the globe and also for the future generation of politicians is a message that will reverb.
Yeah, because I have to say, I learned myself also when creating the storyline. And I saw images of Barack Obama, Bill Gates, Fauci, just saying what you've been saying already quite some times. And then you still wonder, why wasn't it heard? And let's just hope that now, because we have had this pandemic, well, we're still not at the end of the pandemic, unfortunately, but that people remain aware of what has happened and how to be better prepared. Because I can imagine that there are means to be better prepared for the next pandemic, which will surely come. So I can imagine there's a set of measures that could help us to better prepare ourselves in the future.
Yeah, well, first of all, you need to know what is happening. And so you need to basically have sentinels around the globe and see if you have certain patterns of infections that are emerging in certain regions. What is behind that? And also the artificial intelligence, for example, can help. But of course also the high-tech virology and diagnostic tools can help. And once you know that something is sort of popping up, you need, of course, to take action. What happened now was in 2020 that a new virus emerged, and within days they knew the sequence of it and knew it was a new coronavirus. We have been saying for years that coronaviruses are really dangerous, and the other families as well. I'm just losing my line. So I was saying that
be better prepared.
Better prepared, and so they started basically working on vaccines. We started working on vaccines, but it takes time. It took a year before we had vaccines, and this was at an extremely high speed. But it could also be one day that if a new virus is emerging, that it's not possible to develop a vaccine. Just think about HIV. And so what you need then is also, you need sort of on the shelf drugs that are active against all these different families of viruses. For example, the family of this coronavirus. Just imagine that we had back in 2020, somewhere a stockpile at the WHO of drugs that would be broadly active against coronaviruses. They could have shipped that to Wuhan. They could have treated the first patients. They could have prophylactically treated the doctors and the nurses. They could have treated the contacts of these first patients. And together with quarantine measures, this may have had a big impact basically on the early days of the epidemic. We calculated that, basically have a publication on that together with my colleague Neil Hens from the University of Hasselt, in which it is shown that if you would basically have such drugs at hand in the very early days and weeks of the pandemic, that you would make a major impact on these outbreaks, and perhaps this would have delayed very much the spread of the virus around the globe.
And exactly this kind of information is shown in the Planet Virus storyline. So, we urge all the politicians from around the globe to come and pay a visit to Healthskouts. So, many thanks, Johan, to enlighten us with your contribution to the Planet Virus storyline and to give, again, some insights in how to better prepare for the next pandemic. And I might add that also online, you can take a look at the Planet Virus storyline, because we have created a new Planet Virus website where you can take a look at the movies that we created on the Planet Virus storyline in such a way that, you can take a look there at your own ease, but you can also deep dive into additional information. For instance, you can take a look at different articles that we provided there, or also can take a look at the current situation of the coronavirus and all the figures that we hear every day, but you can take a look at all those figures of around the globe. And next to that, actually I'm very proud to say that we created, together with the KU Leuven Institute for the Future, we created an event where we told the story of the Institute for the Future. Let me explain that a bit more. So the Institute for the Future is an institute of KU Leuven where, together with other partners, they're looking at societal wicked problems. So really difficult to tackle problems. And of course, a pandemic is one of those problems. I'm sure you agree with me. And actually, in analogy with the SDGs, so these goals for sustainability, the Institute for the Future, prepared pandemic preparedness goals. So they put out a report stating which kind of measures you could take to be better prepared for the next pandemic. And so, together with the Institute for the Future, we created a kind of kick-off event where we showed the world these reports, we showed the world these pandemic preparedness goals, and actually we had a call to action for everybody in the audience at that time, but also online, to work with us and to think about how we can make sure that these pandemic preparedness goals are really kept alive and that they are really kickstarted. So it was a great event also with world-renowned speakers such as, for instance, Peter Piot, who we all know, and we were very happy to be able to launch that report together with KU Leuven. So next to creating our own inspiring sessions, we also want to contribute to other inspiring sessions. And as one example, I think about Driven by Health, which is a series of seminars organized by the University of Leuven, the University Hospital of Leuven, Leuven Mindgate and Healthskouts. And there we want to talk about the future of healthcare, you know, the passion of Healthskouts. And we want to give this information to a broad audience, to an audience of layman public. And we do not only want to give the information to the broad audience, but we also want to listen to them. So we want to give a voice to the broad audience. And we literally went on the streets with our cameras on different occasions for different types of seminars to ask the opinion of people in the street. And we're going to show you a movie in Dutch, which we call one of our Vox Pops, so for one of those seminars. And it was created for a seminar where we talked about the impact of the corona pandemic on the mental well-being of our young people at that time. It was last year, summer of last year, you know, it was really hard for our young people. So we went out on the streets and asked different people, like, what do you think that young people are feeling right now? Is it hard for them to follow those strict measures? Should they follow the measures more strictly or not? So those were the kind of questions that we asked. And as a kind of teaser, we want to show you a compilation of different types of answers. Let's take a look.
Ja, eigenlijk vrijheid gewoon, ja, we hadden geen vrijheid meer. Gewoon thuis zitten, ja, dat was het.
Er moet een eind aan komen en ja, iedereen moet op zijn tanden bijten.
Geen contact met vrienden, we mogen niet met veel thuis zijn, we mogen niet chillen zo thuis. Dat is wel fucked up, snap je?
Dus het spijt me, daarvoor kan ik geen begrip opbrengen.
In het begin viel het allemaal wel mee, maar we wisten ook niet hoe lang het ging duren. En na die eerste maand, tweede maand, dan was het wel zo wat moeilijker.
Met alle respect voor ieder zijn mening, maar ik vind het belangrijk dat men sociaal denkt.
En dat ging dan moeilijker, dus dan zat ik thuis eigenlijk alles op te kroppen en dan soms barst dat dan wel eens uit. Dus dat vond ik wel heel moeilijk en ja, je kunt dan ergens kwijt, dus en dat was dan een lange periode.
Ja, ik kan het moeilijk inschatten hoe de jongeren zich voelen, want toen ik jong was hebben we zoiets nooit meegemaakt.
So as you can see, we give really a voice to our broad audience. And to give another example of how we think that the broad audience is important is to talk about our Public Thursdays. And these are events where individuals can register for a tour each third Thursday of the month, and they can come to a tour here in the Health House and looking at a different type of topic. So these are our Public Thursdays, and we encourage you to come and follow one of them. And in each tour, we have a very specific highlight. And that highlight is what we call our digital dissection table of the company Anatomage. And well, Anatomage, the word says it already a bit. It's actually a digital table, a digital tool where you can take a look at the anatomy of the human body in very detail. And we use it in different kinds of storylines, emphasizing different kinds of, for instance, pathologies, but also different kinds of surgeries that you can perform on the body. It's a very nice tool to bring a complex pathology or complex surgery in a very understandable manner to our audience. So it's always one of the highlights here in one of our storylines in Health House. There are currently 6 tables here in Belgium, but the only one that you can really visit is the one here in Health House. So come over and take a look at our Anatomage table. So we inspired already a variety of people. I think you already saw some pictures of people coming over to Health House, but we were very honored with visits of, for instance, King Philip, but also different kinds of different policymakers. For instance, Minister Krivits came by, Mr. Beke visited us on Valentine in 2020, but also athletes, as said, the brothers Borlée, for instance, came to Health House for an inspiring visit. And as said, always very welcome to come over and visit Health House. Now it's time to switch gears, and you know we were going to talk about inspiration, we were going to talk about connection, but now it's time to talk about creation. We also create our own storylines. And today I want to tell you about 3 storylines. I already told you about one, Planet Virus, but I really want to emphasize the next storyline. It's a patient education trajectory where we really explain patients a certain type of surgery. But there's a much better person, an expert here in the room, on stage in Health House, that can explain us way better about the surgery, about the pathology, and that is Dr. Bogers. Alexandra, very welcome on stage. Could you please introduce yourself?
So I'm Alexandra Bogers. I'm a resident in neurology at UZ Leuven, and I'm doing a PhD on DBS in movement disorders, when DBS is actually deep brain stimulation.
So, I told you that this storyline, DBS, is all about patient education. So what exactly do you see when you come here to Health House to visit that storyline?
So we take patients, let's say every 2 months here, and there are usually 6-7 patients with their family members, their caregivers, and then we take them around for about an hour and a half, and we're explaining everything about the surgery. Who is eligible, what the advantages are, but also what the disadvantages are, what the risks may be. And we show them different testimonials, but we also let them hold the material. So they can get a real grip of what the surgery is, but also the material.
And what do you mean with the material? What are they then really gripping onto?
So the electrodes that we implant in the brain, then you have the connection wire and the battery, or the neurostimulator, which we implant in the chest or in the abdomen.
Ah, okay. So, and this trajectory actually started already quite some time ago, 2019. Can you elaborate a bit more on how it came about?
Yes, indeed. Well, actually, we had a grant awarded at the KU Leuven from EIT Health, which is a European platform. But the grant asked us to provide some money to education. And that's why we partnered up with Healthskouts to make this tour for our patients.
And what do you see as an impact? And maybe let me tell you something that for the Healthskouts team, this is one of our what we call warmest storylines. And why is that? Because you have patients coming in and, I see from my layman eyes that they really are impacted by the content. But what is it for you with your expert eyes to see that? How do you see that impact?
So there's actually two kinds of people. People who are either afraid of the surgery, who know that it's a solution, but who don't really want to go into it. And by educating them, by showing them the surgery, by showing them the advantages, but also, as said, the disadvantages, they are kind of reassured and they do step in for the surgery. Then on the other hand, you have the people who are super excited to go for the surgery, can't wait to get their operation date. But those people, we tend to make sure that they don't overestimate the potential benefit of the brain stimulation, because there are still disadvantages, there are still risks. And that's what we need to emphasize on during the tour as well.
And what you say is very important. You say the advantages, but also the disadvantages, because you really want to give the correct image and the correct information on the surgery. And that is something I can say that it really matches also with the values of Healthskouts. So it started off in 2019. If I'm not mistaken, the grant period is over. So in layman terms, the money is gone.
Yes.
But how are we going to make sure that the project, because it's so societally relevant, can still continue?
Yes, indeed. So it's a super relevant project. Patients are extremely happy that they've taken the tour, especially also the spouses, because it's important through Healthskouts that we educate the family, because deep brain stimulation is not a choice from the patient alone. So indeed, we are continuing. And so we reached out to the 3 different manufacturers of DBS devices, which is Medtronic, Abbott, and Boston Scientific. And we asked them to support the project, which they did. And because for us, it was really important to involve either all 3 or none. Because for us, it's super important to be neutral. So it's not an advertising campaign for DBS, but it's definitely not an advertising campaign for any 3 of them.
Yeah, and so we started off with tours in English and in Dutch.
Yeah.
Now also switching to French, thanks to your colleague as well, and then even going into German. What do you see for the future? I know it started locally, but I think all the project partners want to spread out into Europe. How do you see that happening?
Yes, indeed. We're super proud that we are currently indeed having English, French and Dutch as tours regularly. And we're indeed going on to German. But what our next step will be is to take the project virtually, because for now we have been reaching people from Belgium. But this message is super important. People from all over the world should be aware about the possibility of deep brain stimulation and should have access to objective information so they can choose to have or not to have the surgery. And that's why we are looking forward in the coming few months to start our virtual tours where we will be able to host anyone.
Yeah, sounds really great. I would like to go back a bit in time to the beginning of the project and actually the creation of the storyline, because for me it's very important that the audience knows that at Healthskouts we always work with experts that guide us to say like, this is the content that you really need. But here it's a very special case because you have experts that want to tell about the surgery, that need to tell specific information about the surgery. But on the other hand, it's a trajectory for patients. So they also have their own questions. How did we manage that?
Yes. So from the very first start, we went out to the patient and we asked the patients, what do you want to know? What are questions that you have? And because patients' questions and physicians' questions are not always the same, and that's how we really wanted to make it personal. And throughout the years, we have had multiple questions, multiple rounds of innovations, as you know, so I think we're about the third version of our content currently. So really want to try and keep up to date, but with a very strong scientific background. So anything we showcase here has some scientific literature stating what we are actually showcasing here.
And maybe as a last question, well, we use a lot of digital content, animations, we use movies and so on. Do you think that's a good way to bring over a message of such a complex thing as a deep brain stimulation surgery? And could other types of surgery also benefit from that?
Oh yes, definitely. So one of the added values here at Healthhouse is that we have the possibility to do so much. So we are showcasing the material itself, a lot of info charts, but also a testimonial. And that way the people feel very involved into the topic. So deep brain stimulation, or DBS Select here at Healthhouse, is just one example. I'm sure that this can be one of the first examples of many, many more to follow.
Thank you very much for sharing your expert insights on the deep brain stimulation trajectory and for the call to action also for other types of surgeries. Well, let's come over, all these surgeons and so on. Let's talk and let's see what we could do together. So next to creating stories, I already mentioned that we also create live streams. And when we create live streams with clients, for instance, we really want to be involved in the process, in the creative process. Because you probably mentioned, we saw already a lot of visuals and animations and movies, and nearly all of them have been made in-house by the creative team of Healthhouse. So that's what we like to do. We like to create a story together with you, to tell your story with you. And I think I can say that, well, we created quite some live streams and that they have been a success, as more than 15,000 people have followed these live stream events. And I would like to give some highlights some examples of these live streams. First one is also actually the first live stream events that we engaged in, and it's called Bronnen van Zorg. It was actually a series of 6 evenings, each with a different eminent speaker, and we explored what we are calling sources of care, but in 2 senses. Caring for people can be a source of care, can be bothersome, but also much more than it can also be a source of solidarity, of resourcing, of fulfillment yourself. And that's what we try to show in these 6 evenings with Bronnen van Zorg. Another live stream we performed together with the Clinical Pharmacology and Pharmacotherapy Research Group of the University Hospital of Leuven with Professor Isabelle François was all about how to improve decision-making across the drug life cycle in Belgium. And we performed this through 4 online keynote sessions. Online sessions that features both keynote speakers, such as Minister Van den Broeke, but also multi-stakeholder panel discussions with live Q&A. And Professor Isabelle François, who hosted the very first 2 sessions of the online symposium, really said the collaboration with Healthhouse was very positive and very enriching, both for her as for the speakers themselves. Another very important series of events we engaged in was actually a series of 8 evenings with Arts in Nood. And Arts in Nood is actually the knowledge center that tries to create awareness for difficult situations or difficulties that medical professionals such as physicians, but also pharmacists and veterinarians are confronted with. You can think about, for instance, aggression towards these medical professionals, how to deal with it, but also mental issues such as depression or burnout. Those are very relevant problems that this expertise center wants to create awareness about. And of course, due to Corona, it was not so easy to put people together in a room and then to talk about these topics. But because of the relevance of this topic, Arts in Nood decided to create an online experience. So 8 online sessions for French sessions for Dutch sessions, in which they highlighted the importance of the problem and also gave tips and tricks how to deal with these type of problems. So it was really nice to engage with this expertise center in conveying a message on these very societally relevant problems with and for medical professionals. And last but not least, we really want to highlight also our live stream, but actually our hybrid events with Zorgi. And Zorgi is a company providing IT solutions for the healthcare sector. And well, they came over here and they wanted to convey their message on their products, on their IT software. They wanted to do live demos, they wanted to give keynotes, show their dashboards and so on to their clients. But of course, Corona was there. So we invited a selected audience of clients here at Health House. They sat within the room where the live stream was being hosted. So there was actually a very nice dynamic between the stages that were taken by keynote speakers and the audience. So audience in the public could ask live questions, but also the online audience could engage in a Q&A. So just some of the very nice live stream and hybrid project that we engaged in. Okay, let's go back to our storylines. So we saw already 2 storylines, but there is still one more storyline that we're really proud of, and which is called RBS. And before really diving into the content, let's take a look at a teaser of this storyline. So, the RBS storyline. RBS stands for Responsible Beverage Serving, and actually it's part of a larger project here in Leuven, which is called the Lazarus Project. And it's a project with a lot of partners. We actually call it a kind of vital coalition. And partners such as AB InBev, the City of Leuven, Twee Perenboom, the Police of Leuven, LOCO, so the student organization, and many more. And actually the Lazarus Project is also a nice way to show how Health House evolved, because we started within the project with one trajectory, which was actually an alcohol sensibilization trajectory for students, where we try to show them how to behave in a responsible way with alcohol. But next to that, we expanded the trajectory to what we call now our Responsible Beverage Serving trajectory. And to talk a bit more on that, I have with me yet another expert, now an expert called Kevin Strubbe. Kevin, very welcome here at Health House.
Thanks for having me.
Please introduce yourself.
I'm Kevin Strubbe. I'm passionate by everything what concerns hospitality. I managed a few restaurants of my own. I worked in Belgium and other countries in hotel business as well. I wrote some books around hospitality, and now I'm involved with your beautiful project, the Lazarus, the RBS. Yeah?
Yes, it's indeed a really beautiful project. And I told responsible beverage serving. Mm-hmm. So we started with a trajectory for young people here in Leuven, and then created the other trajectory, which is actually for hospitality, so for people working in horeca.
Yeah, let's call it the service. Everybody who serves alcohol and works with alcohol. Can be somebody who works in a student bar, can somebody who works in a banquet hotel environment, in a restaurant business, all kinds of different people who comes in contact with alcohol and serves alcohol. Yeah.
All right. And so you're a trainer of the trajectory, so mm-hmm. you guide people through the trajectory, giving tips and tricks, trying also to build a community within such a visit. But what is actually shown within the trajectory? Can you elaborate a bit more on that?
Our goal is to make sure that we have a positive effect on the negative things coming out of alcohol. So we take the people into the experience, the health house experience, where we show them what can go wrong, what can go well, but we show them as well, we don't point the finger, we don't say what they can't do, what they have to do, but we just show what is a nice evening, what could be a nice evening if you go out, if you serve people, but what can go wrong if people get drunk, what about sexual harassment, aggressive people in your bar, negative image, all those kind of things. And then we start working with them, and we go through the trajectory where they see all the negative effects on your body, on your mind, on everything. And we try to give them tips. We go in discussion. We see all kind of things, how underage people, by example, how can we influence them on a positive way? People who are having problems with peer pressure, by example, how can we influence them? What can we do as a server so they can skip maybe one alcohol drink? So that's our main goal, yeah.
And how do you see this trajectory impacting people from people who serve alcohol? Do you see an impact there?
We see a big impact. We see a lot of enthusiasm. In the beginning, people come with critical minds and open minds, but that's good because I'm coming also out of the business, so we can make sure that we have different opinions. But on the end, you see that people get convinced that we call it keep your people, keep your guests in the fun zone. Make sure that it's fun, but don't make them have fun very fast and very fast going down. So, but on the end of the road, people see that for them as well, it's a good thing that people have a responsible feeling about drinking and serving alcohol. Yeah.
So, and when people are coming over, it's always in groups where we try to mix them up a bit. People coming from a very small pub and from a larger restaurant and so on. Do you see a kind of community that is being created within the group?
Yeah, we see a community, and we see also people having afterwards also still keeping in touch and being in contact because they start exchanging ideas how to do it when people get drunk at 1 o'clock. How do you do it in your bar? How do you do it in your hotel? How do you do it in your snack bar? They start exchanging ideas, and that's really, really good. People come even a bit closer by it, yeah.
Yeah, and by getting these ideas, that's also good for us to keep our storyline up to date.
Yeah.
Because then we can include all the best tips and tricks into our storyline. Yeah. So, and I think people already know now how we create storylines and what they are. So it's a collection of movies, virtual reality, digital dissection table, and these interactive touchscreens. How do people react to that? Because it might be a lot. It's content, but it's also the way in which content is being shown. Is it too much, or is it just enough, or?
No, it's never too much, but you have the different stages. That's the first minutes is with everybody the same. Everybody's impressed by the health house and the environment where they come into. And then if you take them through the experience, you see people reflecting, discussing, and seeing also all those help and support we have from them. But you see them changing, and you see being critical in the beginning part, but you see them going into our story, because the story is being brought quite well, I think, and quite structured. And you see people going in together with us. Yeah, it works.
Yeah, and of course the Lazarus project, it's not only the two trajectories here, it's also a lot of other kind of social media campaigns and creating awareness campaigns, also campaigns with physicians. So there are a lot of ways in which here in Leuven, people are trying to raise awareness for alcohol and how alcohol is fun, should be fun, but how to remain it as being a fun thing.
Especially that. And what we try to do as well is not only to have those 3 hours of trainings, but with those movies you were talking about, all those small things, we try to have impact. Let's say our fair enough sign, the sign we use to show the bartender that it doesn't always have to be alcohol and that it's fair enough to drink something without alcohol. All those small things make sure that we have impact, that we not only give trainings, but we want to have an influence and impact on the whole story. Yeah.
True. We also have to admit that for people in Horeca, it was not really easy to convince them to come over to Healthskouts because, it was a sector that was very much impacted by all those measures. We could not go out, we could not go and have a drink, we needed to stay at home. So it was a very much impacted sector. So at the time that we launched, we were actually kind of in the middle of the first lockdown. So it was very hard to convince them, because they could not come out. And when they could come out, actually they felt not in a very good mental state. And that's something that we noticed already throughout the whole trajectory. But that also leads me to my next point, the fact that we evolve as a Lazarus project ourselves. So the next stage that we're now tackling or engaging in is that Lazarus on Wheels type of subtype of the project. Could you explain a bit more on that?
I'm looking so much forward to it. The problem is indeed that it's difficult to find a lot of people to come to the Health House experience. Also because at the moment, hospitality business, they don't have staff because everybody was looking for another job, etc. So if they don't have staff, it's difficult to send people out for trainings. So our goal is, if they can come over here, let's go out to them and let's take the bus and bring in a sort of way that experience as well. So we can go to those youngsters, but as well to a school, as to bars, hotels, whatever, we can go over everywhere now with those nice bus and the Health House experience on wheels. Yeah.
Yes, indeed, and I'm very much convinced that we're going to use now the bus for Lazarus, but I can imagine that also for other types of storylines, also that bus will come in handy to bring the information really to the people that matter and really to our audience. So yeah.
We see a lot of changement in education and trainings as well, because we have the team meetings and the Zoom meetings as well. People make it as much easy as possible. So I think it's our job to make it also easy and to find the middle way between the experience and going out to people. So I'm sure we will manage that. Yeah.
Yeah. Well, thanks for the tip to include user friendliness into the trajectories or into the project in general. So thanks a lot for your expert explanation, and I'm looking forward to the future of the Lazarus project.
Thank you so much.
A lot. Well, actually, that brings us to our fourth pillar. We talked about inspiration. We showed you how we are going to connect people and what we already created. But now it's really time to take a look at our acceleration type of pillar. So thanks to our three other pillars, organizations and people can really accelerate in the products and technologies that they are developing. So they create new stuff, new technologies, new products, new things that we can then show again in Health House, making the circle round, and which is a win-win for everybody, to my opinion. We really want to fulfill the need for a living lab ecosystem where organizations, being it startups or scale-ups or really even established companies, can come into contact with people and end users and with possible clients in an inspiring manner. And that can be done here at Health House, can also be done online, and it can also be done at the site of the organization, maybe using our bus. You never know. And I really would like to give you some examples of acceleration trajectories that Health House created. And the first example is the example of Spentis. And Spentis is a Brussels-based startup company with an innovative 3D printing technology. They use 3D printing for preparing personalized prosthetics. And we got to know them quite some time ago, and we saw the added value of their technologies and introduced them into the Health House network. And I think they're very happy with all these introductions, and I think that the CEO and co-founder of Spentis, which is Louis-Philippe Broze, tells it perfectly in the next movie. Let's take a look.
One of the main events we have been able to attend and also to promote Spentis is the fact that we have been able to sign a partnership with one of the main soccer teams here in Belgium, based in Leuven. We have been able to promote our product and also to provide the products to their players. And that's thanks to the introduction of Healthskouts Leuven. Next to that, we also have been able to attend a very important event organized by the Ministry of Defense, the Federal Ministry of Defense of Belgium, where there were representatives across I don't know how many nations there is in NATO, but a lot. We have been able to showcase our technology with our 3D printers and show how this technology could actually be applied also on the battlefield. So for all these reasons, we would like to advise all startups, to advise all members of the ecosystem to participate and to work with Healthskouts, because it's a unique opportunity to get out of your comfort zone and meet outstanding people. Thank you very much.
Another way to support acceleration is also to be part of your event. For instance, you can invite Healthskouts to be a keynote speaker or to be a panel member or to also moderate a panel discussion. And we had the great honor to be invited by Flanders Investment and Trade to the World Expo in Dubai to moderate actually a panel discussion there with very esteemed panel members. So we were very honored to be given the opportunity to do so. And I would suggest that we take a look and listen to the CEO of Flanders Investment and Trade, which is Claire Tillekaart, who tells a bit more about the collaboration Flanders Investment and Trade had with Healthskouts, but also how Flanders Investment and Trade sees Healthskouts take up an important role in the innovative healthcare ecosystem. Let's take a look.
Hello, ladies and gentlemen. I'm truly honored to share the following story with you at this evening's live stream event hosted by Healthskouts as our valued network partner. Last year, during the global pandemic, Flanders Investment and Trade organized a top-level event during Flanders Week at the World Expo in Dubai. And what better topic to discuss than how to fight future pandemics and global health threats. Were we prepared? That was the big question, to which the answer was no. Can we tackle this challenge globally? There the answer was yes. And most importantly, what is needed to prevent such a massive crisis? Industry experts and NGOs experienced in the fighting of the global diseases presented their vision. The second panel dived deeper into what is needed to prevent or fight new pandemics. Vaccines, yes, but also antivirals, fast and accurate testing, global vaccine storage and distribution, and the foundation of a fire brigade to be ready and quickly scaled up upon a new outbreak. It was interesting to watch a lively discussion between Strategic Research Center IMEC, Brussels Airport Cargo, and executives from the medtech industry on how we can realistically say, never again. Flanders has a leading role in fighting pandemics past and present. At Flanders Investment and Trade, we are proud of our pioneers, including Pieter Piot, Paul Stoffels, Rudy Pauwels, and many others. We are also proud of the fact that our region is among the world's largest manufacturers of vaccines, Pfizer and Puurs being one example. Not to mention our world-leading R&D centers in virology and vaccine development, such as CVAC at Ghent University and Leuven's Riga Institute. The event was a clear showcase of what can be achieved globally by a small region like Flanders, with its clear and strategic focus on innovation, similarly how Healthskouts is a world-class center demonstrating the impact technology has on the future of health and care. Because that's the essence, showing people what new science and technology can do for a healthier world. That's also why FIT is going more and more global as an agency and is establishing more science and technology offices in strategic locations worldwide. We have become one of the world's top regions in healthcare innovation, and we seize every opportunity at FIT to spread the word. On behalf of Jan Wouters as co-organizer and myself, I would like to thank all the esteemed speakers who made this seminar one of the highlights of the Flanders Week at Expo Dubai. And above all, our special thanks to Healthhouse CEO Isabelle François and her team for co-organizing this event, not to mention their highly skilled panel moderation. Let's connect again in 2022.
When we connect with our network, we really want to create a fully personalized experience. And we can do that in contact with our clients. And as an example, I would like to highlight the Digital Laboratory Day that was organized here last year by Siemens Healthineers. And at that specific day, Siemens Healthineers used our infrastructure to convey their own message about their own products, gave live demos with their software to their esteemed clients and VIP guests. And as you can see here from the images, we can really fully adapt our setting in a very flexible manner to accommodate the needs of the clients. Because you can see that here, when you entered Healthhouse on that specific day, it was as if you entered within the Siemens environment. So we really created a fully personalized experience, which we can also create with you. So now we're nearing the end. Yes, indeed. We talked about the 4 goals of Healthhouse: inspire, create, connect, and accelerate. And by bringing these 4 goals together, we really want to create personalized experiences. And we really want to help you tell your story to your clients and to your guests and your stakeholders. So that being said, I really want to urge you also to stay tuned also in 2022, because we are going to release a new feature very shortly, which is called the 22 Questions of 2022. I'm sure you're really curious now what the first question will be. I'm not going to tell you. And now, as our final guest, we want to give the floor to the spiritual father of Healthhouse, Professor Bart de Moor. One question, Bart, when you have seen all the projects that Healthhouse engages in, what comes to mind?
Well, I think it's very impressive because when we created or conceived Healthhouse maybe 5-6 years ago, we could never have imagined the expansion it would take and the number of activities. So basically the origin of Healthhouse was to combine technology with health and show the increasing impact of technology on health in general. So it was a rather technical origin of Healthhouse. But if I see the range of activities that now have been going on, who could have thought that banks would be partners of Healthhouse, that companies would come here, that ministers and kings would visit Healthhouse? So I'm basically, as a chairman, I'm really very proud. And it's of course not me, it's basically the team. It's you, Isabelle, and the whole team that take care of all these things. And it's very nice to be the chairman of Healthhouse.
It's very nice to have you as the chairman of Healthhouse. And then one more question. What's the future for Healthhouse? What is your vision on the future of Healthhouse?
Well, I think first of all, we are going to expand on all the activities we are doing now. And maybe to reveal some parts of the future, I cannot tell everything, but we are looking at a new version of Healthhouse, which is called Healthhouse 2.0, where we also open up for a larger audience. So it will not only be an audience and visitors who are maybe specialized and patients and things like that, but we also would like to expand our horizon towards schools, outreach, science outreach, and so on. And in order to do that, we are now thinking of building and constructing a new Healthhouse called Healthhouse 2.0. So it's still a bit of a secret project. You will hear about it in the near future, I guess, but it will be spectacular. I can guarantee that.
Well, I don't think it's now so secret anymore, but it's just really nice to have you reveal that little tip. So thank you for that. And dear audience, with this, the whole Healthhouse team wants to really thank you. Thank you all for engaging with us in all these exciting projects. And we really hope and we really are looking forward to continue to shape the future together with you. So we hope to see you very soon. Goodbye.